Hello and welcome to the last assignment for Capstone. Yeah, yay! I mean, I'm not happy, but I am happy, so I'll just start there. Um, yeah, so let's get on with the assignment. We're talking about social determinants of health, and the first question is about patient advocacy and barriers to healthcare. So during my clinical rotation at Layton Hospital, I cared for a 72-year-old woman admitted for electrolyte imbalance and malnourishment. She had a history of chronic alcohol abuse and lived at home with her granddaughter, who was her caregiver. But in addition to their limited financial resources, I think they had limited educational or a limited educational knowledge of nutrition. So it was an issue because this was where this woman's malnutrition came from, and the fact that she chose to drink instead of eat for many reasons. No judgment at all. She did have she had limited financial resources, just small stipend that came in monthly from her deceased spouse's retirement. And her only insurance coverage was Medicare. So despite previous admissions for similar issues, she continued to experience this malnutrition and nutritional deficiencies, which just compounded her poor health. So while coordinating her care with our team, I attempted to arrange for home visits from a dietitian to help provide that education to bridge that gap so that maybe she could just have a better outcome overall, like improve her nutrition and that of her granddaughter as well. But I discovered that her insurance only covered a dietitian or a nutrition consultation during her hospitalization, but no home visits. So in addition to that, her Medicaid restricted the length of her hospital stay based on clinical criteria, and limited her time and the opportunity for education and interventions. So this situation really highlighted for me barriers to healthcare that are rooted in economic instability, limited access to health services, and social isolation. Because I think she would do better with some extended intervention as far as nutrition in her household. But okay, question number 2 talks about cultural competence in nursing. And cultural competence in nursing for me refers to the ability of healthcare professionals to understand, respect, and effectively respond to the cultural and linguistic needs of their patients. It involves recognizing your own cultural beliefs and biases and being able to put that knowledge aside and look at and learn what cultural expectations are from other cultures, other ethnicities, and adapting your care practices to meet those cultural preferences and health beliefs of your patients. So cultural competency in nursing is essential in delivering safe and equitable patient-centered care. So through continued learning, nurses can advocate for their patients. They can enhance communication and mitigate effects of social determinants of health, ultimately leading to better patient care and better outcomes for their patients. So always good. The third question is talking about healthcare disparities. And in my last week of Capstone, I had I observed, he wasn't my patient, but I observed some disparity involving an incarcerated patient who was admitted to our unit. he was diagnosed with AIDS while he was there. And although the patient was technically under the state's care, when the state found out that he had a positive diagnosis of AIDS, they furloughed him. And then within 24 hours, the hospital released him because he no longer had healthcare coverage, no longer anyone to pay the bill. Which just, I was speechless in that care coordination, because it just really highlighted the disparity in access and continuity of care for patients, and patients who are marginalized or from the prison population, that, you know, they could just be turned out with very little thought. So, you know, it really would limit his access. It did limit his access because it interrupted his treatment. And there was no further case management and no access to antiretroviral therapy. So the outcome for that patient is not very bright. And there's really, you know, unless he goes and gets a job and, you know, turns his life around, I don't know how he's going to have access to healthcare. It's going to be really difficult for him. And this example just really highlighted how marginalized populations experience unequal treatment and fragmented care compared to the general population. It really illustrates how social determinants of health perpetuate healthcare disparities. So the best way to combat that is coordinated discharge planning, any kind of policy advocacy that could get some of these rules changed, and culturally competent care, which we just discussed. Nurses can play a vital role in reducing inequities and improving outcomes for all of their patients, marginalized or not. So, okay, well, thank you. I enjoyed my capstone very much. Gained a lot of confidence in the skills that I have, and really saw that nurses wear many hats, in addition to patient care and recording that care and documenting that care. But there's a fine balance emotionally between delivering that care and getting involved in sort of helping your patients, because you are limited by your resources through the hospital and your own personal amount of energy, and you have multiple patients to care for, so your energy can't all go into just one patient. So it's going to be tough for me, that part of it, but I will learn how to balance it. So anyway, great assignment, and I hope this video enlightens you into my experiences at Layton ICU, and thanks.